Assalamualaikum warahmatullahi wabarakatuh. My name is Hidayah binti Jalil. Metric number is 079248. We are from Group 12. We'll present about CLO3. We choose to set up a pediatric hospital, and our hospital's name is KMI Pediatric Hospital. Our motto for this company is guiding Little Star to a healthier tomorrow. Before we go further, let me introduce my team member. The first one is Nur Amni Sofia as Chief Executive Officer. Second, me, Hidayah Jalil, Chief Medical Officer. The third person is Nur Syukriyah Nasuha, Chief Operating Officer. The last person is Zunur Anis Shafika, Chief Business Officer. For introduction, I will explain about the problem statement. In Malaysia, government hospital receive all types of patients, including newborns, pediatric, adults, and also geriatrics. Over the time, every government hospital currently facing capacity crisis of the overcrowded patient and also not enough number of the doctors and specialists. Besides, patients also take a long waiting time because of the overcrowd in the existing hospital, including in Terengganu. These matters become more worse for the pediatric patient, which they cannot express their feeling and also level of sickness like us adults. Then, patient will not get their best treatment and also the diagnosis, and this will turn the healthcare frontliners to burnout. This is our main reason why we decide to set up a pediatric hospital in Terengganu.
Assalamualaikum warahmatullahi wabarakatuh. I am Siti Nur Syukriyah Nasuha binti Muhammad Sukri with ID of 079412. We'll be presenting on the location that we will be building our hospital. So, our chosen site is Lot 1402 in Kuala Terengganu, spanning approximately 7.0 acres under the official jurisdiction of the Geran Negeri Terengganu. To maximize operational efficiency, the plot is situated just 25 meters from the main AH19 highway, featuring a front boundary of 916 feet. This layout ensures maximum visibility and allows us to map out a dedicated, unobstructed emergency route directly from the highway to our trauma bay, completely separating emergency patient flow from general public traffic. So, strategically, this site rests on a triple access logic. First, co-locating directly adjacent to the existing KMI Kuala Terengganu Medical Center establishes a synergistic referral network, enabling senior specialists to rotate between buildings seamlessly. Second, this proximity ensures easy transfer during clinical neonatal emergencies where literal seconds matter. Finally, being just 20 meters from the nearest residential boundaries position us right at the doorstep of local families as a trusted community first responder. That's all from me. Let's move on to the next presenter.
Now, I will share the company overview of the vision and mission for this pediatric specialist hospital. For the vision, our vision is to be the #1 pediatric specialist hospital with premier regional center and stress-free environment. For the mission, we want to deliver a high-quality pediatric specialist service in a family-centered healthcare. There are 4 objectives of this company. 1, family-centered care accommodation. 2, form public-private partnerships. 3, ensure high clinical safety standards. And the last one, to minimize outpatient waiting times.
Back with me again. Now we're moving on into our organizational structure. Our management overview is systematically structured into 3 key execution phases. First, the organizational chart, the staffing plan, and our internal credentialing and privileging governance framework. First is our organizational and management structure. Our corporate hierarchy begins with the board of directors overseeing the chief executive officer. Under the CEO, operations are split cleanly into 2 governance pillars. First, the chief medical officer handles clinical affairs, guiding the director of nursing, the head of pediatrics, allied health teams, and our dedicated credentialing and privileging committee. Simultaneously, the Chief Operating Officer manages business operations, controlling facility management, financial billing, procurement, and HR recruitment. Secondly, on our staffing plan, we focus on who we want to recruit and how we will recruit them to support a healing environment in a hospital. First, we aim to recruit a qualified clinical and medical specialists such as doctors and specialists, together with allied health and support professionals including nurses, radiographers, pharmacists, and therapists. We also require administrative and operational staff to manage daily hospital operations efficiently. We will use a structured recruitment and training strategy, including partnership with universities and healthcare institutions, online job platforms, and professional training programs. First, we plan to recruit a clinical and medical specialist for our children's hospital, such as the consultant pediatricians, which they will oversee patient management, provide medical expertise, and ensure proper treatment plans for children. Secondly, we will also recruit the neonatologist, which is important in providing advanced neonatal care and improving infant survival and recovery outcomes. Next, we plan to hire pediatric surgeons who is specialized in surgical procedures for infants and children. These surgeons are trained to manage conditions that require delicate and child-focused surgical treatment. Lastly, we will recruit qualified pediatric nurses with PULSE certification. They will provide continuous monitoring, emotional support, and specialized nursing care for young patients and their family. Overall, this multidisciplinary clinical team is essential to deliver safe, effective, and patient-centered healthcare services for children. Next, for allied health and support professionals, holistic pediatric recovery requires looking beyond standard medicine. We will employ child life specialists who use play and psychological preparation to reduce medical trauma for children during painful procedures. We also will integrate child psychologists to address the mental health needs of families alongside pediatric psychotherapists and nutritionists to guide chronic rehabilitation and milestone delays. Next is the administrative and operational staff. Our administrative staff directly impacts the patient experience. We will employ patient experience coordinators to smoothly guide families and keep them informed. Next, the healthcare informatics officers is also important to manage our electronic medical records (EMR) to ensure modern digital efficiency. Finally, the facility management team plays a crucial role in preserving a child-safe infrastructure using non-toxic building materials and rounded furniture layouts. Next, in terms of recruitment and training strategy, we focus on value-based interview to keep our standards high. It utilizes psychological assessment to ensure incoming staff can keep a calm demeanor in high-stress emergency zones. Also, soft skills training in Bahasa Melayu and English will also be employed so staff can interact more empathetically with the parents and families. For long-term growth, it will be secured through mandatory quarterly continuous professional development (CPD) on updated pediatric guidelines. Next, I will present on our clinical governance framework, which strictly enforces patient safety and operational excellence through our internal credentialing and privileging committee. To minimal clinical risk, we divided our vetting process into two rigorous stages, which is the credentialing process and the privileging process. First, patient safety is strictly enforced through our clinical governance. Our credentialing process relies on primary source verification (PSV), validating all medical degrees and fellowships directly with the Malaysian Medical Council and the National Specialist Register. We also will perform a deep background malpractice screenings and demand proven competency records in pediatric medicine before hiring. Secondly, on our privileging process, it defines the specific boundaries of what a doctor can perform. For example, while a general pediatrician has a regular outpatient privileges, only a verified neonatologist is privileged to perform complex intubation in the ICU. Furthermore, all new hires will need to complete a strict 6-month provisional period where their clinical work is peer-reviewed. This robust structure ensures absolute professional governance. Lastly, to tie our clinical governance framework together, we will establish a dedicated credentialing and privileging committee. This internal body is a vital element for our healthcare management strategy, directly serving two crucial functions. First, it demonstrates internal governance. The committee operates completely independently on business management, allowing senior medical consultants to directly monitor clinical quality and enforce safety standards across the hospital. Secondly, it creates an ecosystem of entrepreneurial networking. By involving external pediatric specialists and regulatory representatives from broader medical network, the committee ensures our hospital stays aligned with evolving national healthcare benchmarks. Ultimately, this committee guarantees that our hospital doesn't just hire personnel, but systematically maintains institutional excellence. Now, let's move on to the next presenter. Thank you.
For entrepreneur networking, we have insurance panel and also collaborations and partnership. For insurance panels, we have AIA Public Takaful, Prudential Assurance Malaysia Berhad and Prudential BSN. We have Great Eastern Life and Takaful, Etika Insurance and Takaful, Hong Leong Insurance and Takaful Ikhlas. Now, I will continue to the collaboration and partnership. We have insurance providers. We also have pharmaceutical suppliers and partnership, and also medical colleges. For the insurance providers, as I already stated before, all the insurance panel will become our partnerships and also have a collaboration with KMI Pediatric Hospital. Second, pharmaceutical suppliers and partnership. We have a few pharmaceutical suppliers, include Duo Pharma, Kota Pharma, Zelig Pharma, Pharmaniaga, Hovid, and also Apet Healthcare. And the last one is medical colleges. For your information, our hospital is a teaching hospital, so we decide to have a collaboration with a few medical colleges for their internship and also collecting data for their final year project. A few universities that we have decided to have a collaboration: Sunway University, UniKL, Monash University, UCSI University, and also International Medical University, Malaysia. For marketing strategy, we have Google Business Profile, medical education contents, advertising, billboard, campaigns, copywriting of marketing campaigns, digital advertising, share partner with any event related to medical, and also event management. For medical education contents, we upload all the contents into our social media, including Facebook, Instagram, and also TikTok. Besides, copywriting of marketing campaign very important to attract the audience. So, our marketing strategy is basically to attract the audience and also the guardian to know more about our hospital, which is the KMI Pediatric Hospital.
Next, moving into our spatial layout, this floor plan demonstrates how our infrastructure is meticulously zoned to foster a true healing environment while maximizing clinical efficiency. We will engineer 4 distinct operational flows to eliminate cross-contamination and overcrowding. First, the public flow, which highlighted in yellow, seamlessly directs visitors and families through the main lobby, outpatient clinics, and community spaces like our play and sensory zones. Secondly, the clinical flow, in blue, ensures immediate unobstructed transit between the emergency department, diagnostics, operating rooms, and critical care units like NICU and PICU. Third, the family flow, in green, isolates long-term inpatient care suite traffic to preserve parental privacy. And lastly, the service flow, in grey, runs completely behind the scenes, managing medical supplies, laundry, and waste disposal. So by placing the central courtyard at the heart of the facility, we will flood the clinical spaces with natural light, directly reducing stress for our young patients, their families, and our medical teams. That's all from me. Let's move on to our next presenter. Thank you.
Good day everyone, my name is Noamni Sofia binti Osman with matrix number 079352, and I would like to explain about our hospital setup and clinical services that we provide to ensure quality healthcare for our children. So the first one is the service of pediatric outpatient clinic, which provide general checkup, vaccinations, growth, and also development monitoring for our children. Second is the pediatric emergency department, which operate 24 hours a day and 7 days a week to provide immediate emergency treatment by our specialized healthcare team. Next, we also have neonatal intensive care unit, which we call it NICU, which focuses on caring for premature babies, critical ill newborns who require intensive monitoring and treatment. We also have rehabilitation and therapy unit, which offers physiotherapy, occupational therapy, and also speech therapy to support children's recovery and development. On this page, I will continue with additional clinical services that are available in our hospital. We also have pediatric specialist clinic, which includes services such as cardiology, neurology, orthopedics, respiratory care, and also gastroenterology. These clinics provide specialized treatment for children with specific health condition. We also have diagnostic and laboratory services department. This unit provides X-ray, ultrasound, CT scan, and also laboratory tests to support accurate diagnosis and treatment planning. Lastly, we also have pharmacy department, which are very crucial for medications dispensation. This department also provides counseling for patients and parents as well as vaccination services. In this slide, I will explain about the patient flow for outpatient services. The process begins with registration, where patient may walk in or book online appointment. Next is the initial assessment where nurses check for vital signs, record symptoms, and collect patient's medical history. If necessary, patient proceed to do diagnosis tests such as laboratory investigation, X-ray, or another imaging services. After that, patient meet the doctor during the consultation stage where diagnosis and treatment plans are explained. Patient then proceed to pharmacy and payment section to collect medications and complete payment using cashless option if preferred. Finally, patient will receive follow-up appointment for continuous monitoring and ongoing care. The previous slide, I already explained about the patient flow for outpatient services. Now, in this slide, I will continue to explain about the patient flow for inpatient services. The process starts with admission, where doctors decide if hospitalization is required and patients are admitted to the pediatric ward or NICU. Next is the treatment and monitoring phase, which nurses and specialists continuously monitor the patient while providing medications and therapies. The third stage is family communication, where parents are regularly updated and emotionally supported, or counseling is also provided in our hospital. After the patient improve, they move into the recovery and care phase in preparation for discharge. Then comes discharge planning, where doctors provide home care, instructions, and medication. Lastly, patient attend follow-up care appointment to ensure recovery and continuous health monitoring. I would like to highlight the technologies used in our hospital to improve our healthcare services. First one is Electronic Medical Record System, or we call it EMR, which stores patients' information digitally for faster, safer, and more accurate access. Secondly, we also provide online appointment system, which allow parents to book appointment conveniently through our hospital website. The third one is telemedicine services, where patients can consult specialists from home without needing to visit the hospital physically. We also introduced digital queue management system, which provide real-time queue updates and SMS reminder to reduce waiting time. Next is the smart monitoring system, mainly used in NICU and inpatient ward for real-time patient monitoring and faster response to emergency. Lastly, the technology used in our hospital is cashless payment system, including e-wallets, Do It Now, online banking, and insurance integration for easier and more efficient payment processes.
Assalamualaikum warahmatullahi wabarakatuh. I am Zunra Shafika binti Muhammad Zulkifli, and I will be explaining about the financial plan and sustainability plan for our KMI Pediatric Specialist Hospital. So first, I will explain about the startup cost. To set up our Pediatric Specialist Hospital, we need capital for several important areas. The first cost is building and renovation. Since this hospital focuses on children, the design must be safe, comfortable, and suitable for young patients. This includes consultation rooms, children's wards, waiting areas, play areas, and emergency treatment spaces. The second cost is medical equipment. We need child-sized and specialist equipment such as pediatric beds, monitors, incubators, infant warmers, nebulizers, oxygen support, and emergency equipment for children. The third cost is licensing and legal fees. Before the hospital can operate, we must complete business registration, hospital operating license, healthcare permits, and other legal documents. The fourth cost is IT systems and office setup. This includes electronic medical records, appointment systems, billing systems, computers, printers, furniture, and reception counters. The fifth cost is initial medicine and pediatric supplies. We need to prepare child-appropriate medicines, vaccines, syringes, gloves, masks, bandages, disinfectants, diapers, feeding supplies, and emergency supplies. Lastly, we need funds for specialist staffing and marketing. This includes recruiting pediatrician, trainers, pharmacists, lab staff, and administrative staff. Marketing is also needed to promote the hospital to parents, families, schools, and the community.
I will continue to explain the hospital risk management approach. The first step is to identify where the potential risks that may affect hospital operation are recognized. The second step is to assess where likelihood the impact of each risk are evaluated. The third step is plan and implement, where strategies and action plans are well developed and carried out effectively to reduce risk. Finally, hospital will monitor and review continuously to improve the effectiveness of risk management and maintain high-quality healthcare services. In this slide, we can see several important risk categories together with the mitigation strategies and action plans are prepared by the hospital. The first category is financial risk. To reduce financial problem, hospital prepared detailed budget, secure investment, and controls operation costs efficiently. The finance department will conduct monthly financial review, compare budget with actual spending, and diversify revenue source. Monitoring is done quarterly. Next is human resource risk. The hospital focuses on providing competitive salaries, staff development program, and wellness initiative to maintain employee satisfaction and productivity. Action plans include staff training, recruitment, retention strategies, and employee satisfaction survey. This is monitored twice a year by the Human Resource Department. The third category is technology and system risk. To ensure smooth hospital operation, the IT department perform regular system maintenance, data backup, disaster recovery preparation, and also cybersecurity protection. Action plans include IT audits, backup testing, and cybersecurity training. Monitoring is conducted monthly. There is also patient safety and clinical risk. The hospital emphasizes standard operating procedures, staff training, infection control, and patient safety measurement. Medical services team conduct clinical audit, incidents reporting, and safety committee reviews every month to maintain healthcare quality and patient safety. I will continue with the fifth category, which is competition risk. To remain competitive, hospital provides specialized and child-friendly services, strong branding, and also excellent patient experiences. The marketing department supports this through campaign, community engagement, and continuous service quality improvement. Monitoring is done quarterly. Next is legal and regulatory risk. Hospital ensures compliance with Ministry of Health regulation, accreditation standards, and licensing requirement. Action plans include regulatory audits, policy review, and staff compliance training. Monitoring is conducted biannually by the Quality and Compliance Department. Last but not least, final category is environmental and disaster risk. Hospital prepares disaster management plans such as emergency drills, evacuation procedures, and backup power system. Safety and security departments conduct drills, facility inspections, and regular updates for disaster plan to ensure readiness during emergencies. Monitoring is carried out quarterly. Overall, effective risk management helped the hospital to maintain safety, operation stability, service quality, and patient trust. Thank you.
Next is our funding sources. Our hospital can be funded through several sources. The first source is owner capital, which the owners contribute their own money to support the early setup of the hospital. The second source is bank loans. These loans can help cover larger expenses such as renovation, medical equipment, IT systems, and daily operations before the hospitals becomes fully profitable. The third source is private investors. Investors can provide financial support in exchange for future returns or shares in the business. The fourth source is healthcare partnerships. We can work together with insurance companies, clinics, pharmacies, and medical suppliers to reduce costs and improve services. The fifth source is corporate sponsorship. Companies may support child health programs, vaccination campaigns, and health screening packages as part of their corporate social responsibility. The sixth source is government or healthcare grants. We can apply for grants related to child healthcare, vaccination, public health, or community health programs. These different funding sources will reduce financial pressure and make the hospital more stable from the beginning. After the hospital opens, we will have regular operating expenses. The first expense is staff salaries and benefits. This includes monthly payments for pediatricians, nurse, pharmacists, lab staff, administrative staff, cleaners, and security workers. The second expense is medical supplies and medicine. Since this is a pediatric hospital, we need regular purchases of child medicines, vaccines, disinfectants, and emergency supplies. The third expense is utilities and maintenance. This includes electricity, water, internet, air conditioning, cleaning, equipment servicing, and building maintenance. The fourth expense is insurance and legal compliance. The hospital needs hospital insurance, staff insurance, professional liability insurance, license renewal, and safety compliance costs. The fifth expense is marketing and promotion. We need to continue promoting the hospital through social media, website updates, brochures, health campaigns, and child health awareness programs. The sixth expense is administrative and daily operation costs. This includes office supplies, billing systems, patients' records, laundry, waste disposal, transportation, and other daily hospital operations. By monitoring these expenses properly, the hospital can avoid overspending and maintain financial control. Now I will explain the revenue sources, which means how the hospital will earn income. The first source is consultation fees. Parents will pay for consultations with pediatricians and child specialists. The second source is inpatient and ward charges. The hospital will earn income from children who need admission, treatment, nursing care, and room services. The third source is diagnostic and laboratory services. This includes blood tests, urine tests, x-rays, and other diagnostic imagings needed for children's diagnosis. The fourth source is vaccination and health screening packages. The hospital can offer child vaccination packages, growth monitoring, developmental screening, and school health checkups. The fifth source is pharmacy sales. The hospital pharmacy will provide child appropriate medicines prescribed by doctors. The sixth source is insurance claims and corporate panels. The hospital can work with insurance companies and corporate organizations so that more families can access our services through medical coverage. Having multiple revenue sources is important because it helps our hospital become more financially stable and less dependent on only one type of income. Finally, I will explain our sustainability plan. To make sure the hospital can grow and succeed in long term, we will focus on several strategies. First is cost control and budget monitoring. We will monitor expenses regularly, reduce wastage, compare supplier prices, and manage resource efficiently. Second is high patient satisfaction. Since our patients are children, we must provide safe, child-friendly, and quality healthcare services. When parents trust our hospital, they are more likely to return and recommend us to others. Third is strong healthcare partnerships. We will collaborate with insurance companies, schools, clinics, and corporate organizations to increase patients' access and support our services. Fourth is use of modern technology. Digital systems such as electronic medical records, online appointments, and billing system will improve efficiency, reduce errors, and save time. Fifth is continuous staff training. Regular training will help doctors, nurses, and staff improve their skills, communications, and quality of pediatric care. Lastly, we will focus on expansion of services. In the future, the hospital can introduce more pediatric specialist services, child health programs, vaccination packages, and preventive healthcare services. Overall, our financial and sustainability plan shows that our pediatric specialist hospital is practical, well planned, and has strong potential to become a trusted healthcare provider for children and families.